We would like to welcome to the program Dr. Jack Kevorkian. Good morning, sir, and how are you on this Friday morning?
Good morning. I'm fair, thank you.
Well, pleasure to have you on.
Anyway.
What's that?
I don't have any pain.
Well, that's a good thing. No aches, no pain. So after that, it's all gravy. Let me ask you this, Doctor. You were quite the focus of national and world attention here a decade or two ago. And then, of course, things have been kind of quiet. I suppose that's because you have been doing a sentence based upon what you were spearheading there in the 90s. Now that you're out of the pen, has your effort towards assisted suicides changed at all in your philosophies?
Well, my idea and my efforts, no, but I can't do it. I'd go to prison again.
Right. But are you able to talk about, your ideas and let's back up. For those that aren't aware of who Dr. Jack Kevorkian is, you're a medical doctor, and sometime in your course of your career, you recognize the fact that there are folks out there suffering that would be better off if they were not alive anymore. Is that correct?
That's right.
And at what point in your career did you start to recognize that that in some way, instead of helping people necessarily to be alive, maybe it was better that somebody would help some folks that were in so much pain, or that life just was not good for them, to end that life? At what point did that change for you?
Well, that changed one day in California when I was out there sitting in the lobby of a small hospital. And on television, suddenly, the news came across 60 Minutes, where the Netherlands had legalized euthanasia.
Mm-hmm.
That really struck me. That shocked me. I've always been interested in it. I knew there was a need for it always, but I wouldn't talk about it because I'd lose my license.
Right.
And that triggered it. Then I decided that I'm going to work to get this thing as a routine service in the United States.
Now, the opponents to this, their argument is what? I mean, what's their biggest number one argument in opposing, euthanasia of folks?
Religious argument, and religious based, and even if it's not, it's still motivated by religion.
Mm-hmm.
And they don't want to offend their priest, or they don't want to be excommunicated or something like that. And so they oppose it. But if you're a doctor and you oppose this, then you're not a doctor, because there is a need for it, and there's no other recourse but death to end the suffering. That's all there is to it. That's like, doctors don't like to cut legs off because they like cutting human legs off. But when there's a cancer in the leg, he has to cut it off. He's trying to get rid of the cancer. So his aim is different than what the news media make it.
Now, according to the a documentary that is airing currently on HBO called Kevorkian, you've had some kind of assistance towards 130 people having an assisted suicide. Is that correct?
Right.
Any of those come back and you think, well, maybe the decision was? Have you had any second thoughts on any of those?
No. I wouldn't do it if I had second thoughts.
Yeah.
I wouldn't have undertaken it.
Anybody tied in with any of these 130 people that you assisted in a suicide come back, extended families or whatever, that really still don't see it as your patients and you saw it?
Yes. We've had cases where the patient himself said, I don't want my children here.
Mm-hmm.
And those children, of course, are going to be offended. And they're going to make it look negative.
So eventually you were convicted. You had to do some time. It was reduced a little bit, as most sentences are. You're out. And at this point, has the feeling in any of the medical community or the legal community changed at all in the 15, 20 years?
No, the AMA still opposes it and calls it criminal act, although more than almost 80% of the doctors approve of it. They even say they do it now secretly.
How many assisted suicide?
Lose their license.
How many of those cases do you think are happening in a guesstimate in the country, in the United States of America right now, would you say?
Many. It's widespread.
And
they admit it. Yet they keep it. They keep it as a crime because the church says it's a sin. And our ethics in medicine are not medical ethics; they're religious ethics. Because medicine's always been tied with religion. During the Middle Ages, all the hospices were religious orders.
So in the world, who else in the world is okay with this philosophy in this way?
The Netherlands.
Only the
It's
Netherlands.
the only country that does it correctly as a medical service. These three states we have, Montana, Washington, and Oregon, that's not the way to do it. A doctor can't even do it. He stands there and looks. He writes the prescription for the lethal dose of drug. Pharmacy may refuse to fill it. And then when they get the drug, the patient has to take it himself. If he can't swallow, he can't take it. If he can't move, he can't lift it up to his mouth. And so a doctor anybody who helps him swallow will go to prison. How's that for a medical service? How's that for sanity?
It does open up the thought process here, and I suppose your HBO documentary on you, Kevorkian, even opens up more trains of thought on that. Now that's airing all month long, and it goes into next month a little bit. Is that correct?
What's that?
On HBO, the whole story of your life and all of this is.
It's not the whole story. It's much of the story, as accurate as you can make it in a movie.
Besides having the
documentary is fairly accurate. Those are actually, they use film clips that I took of certain patients when I interviewed them, and they sandwiched Pacino into the scene, like what's that name, Gump movie?
Oh, the Forrest Gump, yeah.
Yeah, they sandwiched Pacino in there, and with my voice.
Oh, really?
Yeah.
Did you ever think Al Pacino would be playing your part?
They showed Pacino, but they had my voice in there, and it was perfect continuity. Perfect continuity.
Well, we look forward to seeing that. That is being shown on HBO right now. And Dr. Jack Kevorkian, it's a pleasure to talk to you. It does open up a train of thought that can get a lot of us thinking. And, probably not in our lifetime will there be a change, but maybe sometime in our kids' or grandchildren's lifetime there may be a different ideals set forth.
I think it'll be quicker than you think now because it's overwhelming support for it.
All right. Well, thank you for joining us this morning on the program, and good luck with the endeavors that you spearhead in the future, all right?
Thank you.
Thank you, Doctor. Bye-bye.